Distinguished guests, ladies and gentlemen, please asking you all to stand on your feet for the chants and praises of our dearest motherland, the Gambia national anthem. You can please take your seats. Thank you very much. Distinguished guests, ladies and gentlemen, I now call on the Bishop of Gambia, Bishop Reverend Ellison, to please lead us in praise. Welcome to the podium, sir.
In the name of God, the Father, Son, and Holy Spirit. In the name of God, the merciful and compassionate. We thank you, Lord, for bringing all of us here today to the laying of a foundation stone for the long-awaited Horizons Clinic. Merciful God, you have always raised generous men and women from one generation to another, whose hearts have always reached out to the sick. God, the merciful one, we are aware of the many preparations, agreements, and hard work that are needed before even one stone can be laid. Today, we ask you to bless and to sustain the members of the Board of Trustees going in and out to various offices to make this project possible. We thank in a special way the one who initiated this dream some 5 or 6 years ago, Dr. James Endow. May the good Lord reward him abundantly, and may he see the day when the first patient will be admitted to Horizons Clinic. God our Father, when we look around some of the countries in Africa, South Sudan, and elsewhere in the world, we look at the horrible conditions in which so many children and mothers have no access whatever to basic health needs. God, the merciful and compassionate, we pray for those who suffer so much, and we ask you to put an end to wars and violence. In that context, we sincerely thank you, Lord, for the health services we have been able to access in the Gambia, even with the constraints we encounter. Nonetheless, today we are privileged in the Gambia to deserve a professional health center at this moment. And for this, we have been blessed in abundance. Praise the Lord, all you nations. Acclaim him, all you peoples. Strong is his love for us, and he is faithful forever. Amen.
Thank you very much, the Lord Bishop of the Gambia, Reverend Bishop Allison. And I call on Dr. Adam Masala, of course, a family in the health sector, to lead us in the Muslim prayers. Doctor, please.
Assalamu alaikum. A'udhu billahi minas shaitani rajim. Bismillahir rahmanir rahim. Alhamdulillahi rabbil alamin. Ar-Rahmanir Rahim Maliki yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina as-siratal mustaqim, siratal ladzina an'amta alaihim, khairil maghdubi alaihim waladdallin. Allahumma anta rabbi la ilaha illa anta alayka tawakkaltu wa anta rabbul arshil azim. Ma sha Allahu kana wa ma lam yasha lam yakun. La hawla wa la quwwata illa billahi al-aliyyil azim. Ahlamu anna Allahu ala kulli shay'in hadirun wa anna Allaha hadha hatar bi kulli shay'in ilman. Allahumma inni a'udzu bika min sharri nafsi wa min sharri kulli dabatin anta ahisun binasiyatiha inna rabbi ala siratil mustaqim. Rabbana atina fi dunya hasanatan wa fil akhirati hasanatan wa qina azaban nar. وادخلنا الجنة مع الأبرار يا عزيز يا غفار يا رب العالمين. اللهم صل على سيدنا محمد صلاة تنجنا بها من جميع الأحوال والآفات وتهدي لنا بها جميع الآيات وتطهرنا بها من جميع السيئات وترفعنا بها عندك على درجات وتبلغنا بها الصالحيات من جميع الخيرات من جميع الخيرات من جميع الخيرات في الحياة وبعد الممات. سبحان ربك رب العزة عما يصفون وسلام 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 على المرسلين والحمد لله رب العالمين. Amen. May God answer our prayers.
Thank you very much, Dr. Salah. Your Excellency, the President of the new Republic of the Gambia, Excellency President Adama Barrow, Your Excellency the Vice President, Madam Speaker of the House of Representatives, my Lord the Chief Justice, Cabinet Ministers here present, members of the Diplomatic and Consular Corps, heads of government departments and the parastatals, distinguished invited guests, distinguished ladies and gentlemen, all other protocols duly observed. I would like to seize this opportunity to welcome you all to this auspicious and the historic event in the annals of Gambian history, being the laying of a foundation stone for the construction of the most modern, world-class and sophisticated hospitals, not only in our sub-region, but the whole world. And this is Horizons Hospital. Can you please put your hands together to thunder a storm? Horizon Hospital is to be equipped with a state-of-the-art medical facilities. The project has been conceived by a medical veteran dedicated and philanthropic son of the soil, an asset to the nation, pride to Mama Land, a strong pillar to lean on, without any hesitation to classify him as a man of time, in the person of Professor James Ndao, who over the years thought of what to contribute to the socio-economic development of his beloved country, the Gambia, that we all cherished. Horizon Hospital is therefore a dream by Professor Ndao to have a modern medical world-class facility in the Gambia, providing the much-craved medical care to not only Gambians, but tourists and the patients from our West African region. He therefore wants to see that one day Horizon Hospital becomes the best medical facility in the entire world, and that people will say, "Whoa, and this happened in the Gambia." Distinguished guests, ladies and gentlemen, kudos to Professor James Ndao for his brilliant, thoughtful and timely initiative. Distinguished guests, once again, ladies and gentlemen, please join me to applaud him. If you all can stand, please, with a standing ovation to this pride of a nation. Can I see you all stand with a standing ovation? Thank you very much. You can take your seats. Distinguished guests, ladies and gentlemen, the importance of medical care to public health cannot be overemphasized. Medical research has shown a correlation between medical care, improved quality of life, and increased life expectancy. To have a healthy population with radiant workforce, there is need to have proper access to modern and advanced medical care. In view of the foregoing, I strongly believe that the coming of Horizons will greatly complement the efforts of government in ensuring a healthy population to embark on development projects that will unfold under the new government, of course, spearheaded by His Excellency President Adama Barrow. The new Gambia therefore heralds that beginning of unprecedented development that will touch on different sectors of the economy. Health is therefore a top priority in government's development agenda. The construction of Horizons Hospital will therefore complement the efforts of government in realizing its objective of ensuring a healthy population. Professor James Ndao has therefore set the pace to be emulated by many Gambians out there, especially in the diaspora. This is New Gambia, new vision, new destination, new hope. I therefore urge others to follow the footsteps of Professor James Ndao to come and invest in the Gambia, home sweet home, to make it better for us and our children, as well as for the future generations yet unborn. Distinguished guests, ladies and gentlemen, on this note, I would like to thank you all for listening. I'll now follow the order of the program and thank you all once again for listening. I'd like to welcome you once again. I will, at this juncture, like to introduce our speakers today. We'll start with Mr. Chairman, the chairman himself. Dr. Melvis George. Dr. George is a public health expert and specialist, clinician with 30 years national experience, including working with the World Health Organization as Health Systems Advisor, Regional Office, AFRO. 5 years as WHO representative to Ghana, 2.5 years as WHO representative to Uganda, and 1 year as coordinator in the Global Health Workforce Alliance in WHO Geneva. He is a Gambian by nationality. Sir, welcome to the podium. Can you please give him a round of applause? Dr. Melville George, please.
Your Excellency, the President of the Republic of the Gambia, Madam Barrow, Justice C, representing the Chief Justice of the Gambia, Madam Claudia Cole, representing the Minister of Health and Social Welfare, all of the cabinet ministers here present, members of the diplomatic corps, security chiefs, permanent secretaries, directors, trustees of Horizon Trust, private investors to Horizons Clinic, the consultant to the implementation of the project, my Lord Spiritual, family and relatives of James Now, friends, colleagues, distinguished ladies and gentlemen. It is with great pleasure and happiness that I welcome you all, and in particular, His Excellency the President and your team for finding time to attend this event. Your Excellency, your presence here with the members of your government is a reflection of your commitment and positive leadership to quickly grasp the importance of the project and according it the priority it deserves as one of the key ingredients for the socio-economic development for the country. Mr. President, distinguished guests, I have 3 messages. The first is that today is a great day for the health sector in the Gambia. Great in that Horizons Trust Gambia is the philanthropic arm of the Horizons Clinic. The Horizons Trust Gambia is, as the main beneficiary of Horizons Clinic, will receive funds from profits of the clinic in addition to funds mobilized from other sources and partnerships to supplement the efforts of government in health service delivery. The vision of the trust is inextricably linked to that of the clinic, that is, preventing mothers and children from dying by focusing on the basic principles of infection prevention and control, particularly during delivery. The trust so far, ladies and gentlemen, Your Excellency, has spent in excess of $2 million to support maternity units in 6 health facilities, namely Serekunda Health Center, Kafuta, Fajikunda, Brikama, EFSTH, and the Foundation for Peace Hospital. Initially, the trust focused on the training of nurses, orderlies, and support staff on infection control and prevention. However, we realized that such training to be effective, there needs to be a change in the working environment. In this regard, we moved on to support infrastructural works, such as the solarization of the maternity wings in Fajikunda and Serekunda health centers for assured uninterrupted light and hot water supply, revamping of the drainage systems to ensure that soakways, toilets, taps, and showers are all functioning, Washing machines were provided for Serekunda and Fajikunda so that laundresses no longer use their bare hands to wash soiled materials. Over the past year and to this date, cleaning materials such as detergent and bleach are being provided to these facilities. At this stage, Your Excellency, ladies and gentlemen, I would like to recognize the trustees and thank them for the support and commitment they have provided to the trust. His Lordship the Bishop, Allison of the Gambia, Dr. Ulrich Jones, a renowned surgeon, Mr. Augustus Prom of the Augustus Prom Associates, and Dr. Lamin Marina, who unfortunately could not be here also. Absent also are Mr. Aki Allen of the Gambia Electrical Company and Mr. Pitendau. Thanks to you all. Thanks also to our indefatigable support manager and administrator, Tina Manjang. Let me also take this opportunity to thank our benefactors, Brussels Airlines, Africa Bike Ride, Ngala Lodge, Soapbox, and the UK Horizons Trust for all the financial, material, and moral support. Your Excellency, the second message is that Horizons Clinic is good for the socio-economic development of the Gambia. The clinic will provide jobs during its construction, jobs when operational. The clinic will provide jobs for health workers. The clinic will collaborate with the medical school to provide residency and internship programs for doctors, nurses, and other health workers. Above all, it will boost the tourism sector by providing the quality health care that is being demanded by high-level tourists and medical tourism per se. My third message, Your Excellency, is that of celebration. Celebration of James Dow. Not the life of James Dow, because he's still a young man. He's not gone from us yet. I remember James as a young boy going to Aberdeen to study medicine. He excelled at medical school and secured all the required surgical training to become a urological surgeon, and in addition, bagged a PhD. As a consultant surgeon, at the age of 40, he was elevated to the prestigious position of professor of urological surgery and director of the academic urology unit in the University of Aberdeen. And thereby assuming the first chair of urology in Aberdeen's history. According to a press release from the University of Aberdeen, and I quote, Professor Dow has put Aberdeen's urology expertise on the map. Professor Dow, a urology expert, is a co-founder and managing director of the urological cancer charity, UCAN. He is one of a few world-renowned experts in the field of urology. UCAN has raised around $30 million so far and funded the opening of the first urological care center in Scotland, formally launched by the health minister in 2008. James was also the coordinating editor within the Cochrane Incontinence Review Group from 2008 to 2012. His research interests are in evidence synthesis and evidence-based practice, large observational studies, and multi-center randomized clinical trials with a competitive research grant of over $30 million. Professor Dow has a urological surgical practice in Aberdeen Teaching Hospital, subspecializing in penile, and urethral surgery. Currently, Professor Dow is the chairman of the Guidelines Office Board of the European Association of Urology. Mr. President, these are no mean achievements. James, over 10 years, was part of a surgical team performing surgical operations at the EFSTH hospital. However, faced with numerous challenges, James came up with the idea of setting up a clinic that he will have control over and be able to provide quality care and at the same time providing support for those who cannot afford such services through a sustainable basis in a philanthropic platform, therefore putting in place a new paradigm for poverty alleviation. This is how Horizons Clinic was born. James made numerous trips to the USA, Europe, and parts of Africa, establishing and galvanizing partnerships. On his idea, he finally convinced the ADB and the IDB to be interested in this area and to commit financing to the project, in addition to private equity. This is a project, ladies and gentlemen, Your Excellency, that has been scrutinized through the eye of a needle and supported by numerous studies and analysis from top world consultants such as the Oxford Policy Group to establish and verify its viability. The project has gone through all due diligence and has taken over 10 years to arrive this stage. Your Excellency, ladies and gentlemen, the vision of James is to make this clinic one of excellence, so that many will not have to leave the shores for further treatment elsewhere, but also that many will come to these shores for quality treatment. James's vision is that in the near future, Horizons will be one of a number of such centers providing quality care in the Gambia and working together with other colleagues for a better and healthy Gambia. As I draw to a close, kindly allow me to recognize Dr. Kathleen Dow, the wife of James, who with the children bore the numerous lonely moments when James had to travel across the world to promote the project. Thank you, Kathleen and children. And here I beg your indulgence, as you sit in your chairs, please just remember and say a little prayer for Dr. Dow and Mrs. Dow, father and mother of James, who but for a call to higher service would have liked to be in person and to be proud of James. However, we know that they are with us in spirit. In the same manner, I kindly want you to remember and say a prayer for the late Dr. Hatib Jai, who passed away last year. He was the first secretary of the Horizons Trust. He served with diligence and commitment. Let me also thank the team, and here I can recognize Omar Kamara, William Jai, Jamila, and Tina herself, and so many behind the scenes, whom I cannot mention for reasons of time, for the sterling work they have done in transforming the environment to make it conducive for this event. Allow me, Mr. President, also to thank all those who in one way or the other gave unflinching support to the program in the last dispensation. Finally, let me thank again Your Excellency the President for grasping the idea of the clinic and for giving us all the required support with your cabinet colleagues and officials. We can understand that it is not too easy to prioritize and make decisions among competitive priorities in the first few months in office. You have done well, and you will continue to do well. As regards to the Horizon journey, Mr. President, allow me to end with the modification of the famous lyrics of the one and only Osibisa. Horizons Clinic is going. We are moving. The road has been hard, muddy, and rough. We are almost there. Heaven knows how we will get there. However, with your support and all stakeholders in the government and beyond, heaven knows we will get there. We know we will. Thank you, and God bless you all.
Your Excellency, Mr. Adama Barrow, President of the Republic of the Gambia, Your Excellency, Vice President of the Gambia, Honorable Speaker of the National Assembly, His Lordship, the Chief Justice of the Republic of the Gambia, Honorable Ministers, members of the Diplomatic and Consular Corps, Honorable members of the National Assembly, Your Lordships, the mayors of Banjul and Kanifing Municipal Council, venerable religious leaders, distinguished ladies and gentlemen, allow me to say all protocols observed. Today, Your Excellency, we celebrate the Gambia. We celebrate two principles and one philosophical belief related to healing. Today, we also take the first practical step in bringing to life the culmination of these principles, and I believe in the Gambia, the smiling coast of Africa. The Gambia is particularly suited, speaking literally and economically, for this next step. And it is suited by its most accommodating and welcoming culture, and by its indomitable commitment to peace, stability, and development in our region. Your Excellency, we celebrate the Gambia and Gambians who live abroad, have done excellently abroad, but remain connected, indeed maintain their umbilical cord connection to their country of birth, and are committed to the development of their beloved Gambia. We celebrate today the principle of entrepreneurial philanthropy based on the highest and best social values. Lastly, Your Excellency, and rooted in all that I have said so far, we bring health care based on the best international standards of medical care to Gambians and the greater West Africa region in the exact location where they need it. Their cultural milieu, a factor critical to healing, enhanced by natural surroundings. Permit me, Your Excellency, to use the opportunity you have afforded us today, Monday, 19th June 2017, to address each of some of these points in detail. I thank you on behalf of Horizon Clinics for the generosity of time you have afforded us to turn the sod at the start of the building of Horizon Clinics' 60-bed hospital, dedicated as it is to the highest international standard here in the Senegambia area of the Gambia. Gambia is, in my view, the most peaceful and secure country in West Africa. Indeed, in Africa. But I confess, I'm biased because of my love for this land. It is the most accommodating of people and clearly of inward flow of investment. Her people are gentle, always helpful and friendly. No wonder its main industry is tourism. But tourism is limited by the weather to about 7 months in the year and leaves the original reason in the history of tourism, which is health. We believe that this hospital, once operational, will extend the great industry. This great industry, we will begin medical tourism. The low season will be enhanced by visitors and families from the greater West Africa. How did this project come about, if I might just go into that? It was the brainchild in 2007, almost 10 years to the day, of a certain Professor James Ndao, a Gambian. James Ndao, as we've been told, is professor of urological surgery at the oldest medical school in the world, University of Aberdeen, Scotland. The first professor of urological surgery for 500 years, and he's an African. But he's a Gambian. James is also chair of the European Society of Urology Guidelines Committee, and we've been told other things about him. But importantly, James studied medicine under a British Council scholarship after working a year or so at the over 70-year MRC here in the Gambia, a center of excellence established by the British, following his brilliant A-levels, also here in the Gambia. Herein, I think, lies the connection for the next point. His career and sojourn in the UK, not to mention his marriage to a great Scottish girl, herself a medical doctor, has brought immense contribution to the UK NHS in his area of expertise and the striking friendships and the building of a large network with so many in international arena, the medical and beyond. It must have been this rich network and the most interesting principle and philosophy that gave him the sinews, the courage, even the temerity of taking the next steps later outlined. And I ask again, what was this principle and philosophy? I think it is best articulated in an interview Professor James Ndao gave to the African World, hosted by Kwame Clement in the US. There's a reference to that. But the principle is what James labeled entrepreneurial philosophy, entrepreneurial philanthropy. As a doctor, he wanted to bring healthcare of the highest standards to his beloved Gambia. Yes, philanthropy, in fact, read charity, will be happy to help from time to time. But was that really sustainable? And charity institutions in the UK wanting to help in Africa had seen an avenue based, I suppose, on any project proposed by James as a way of helping. There was trust of and trust in this young Gambian. But he believed that to be sustainable, any project will have had to have a private sector partnership. That way, the private sector can meet its own goal of fair return on capital, and philanthropy can fulfill its purpose of care and help. What an interesting concept, and quite a scoop, if you ask me. That then empowered him to take the next steps, and the rest is history. On 5th July 2007, he articulated his vision, and a number of people he has brought into it has already, thanks goodness, been indicated by the chairman of the Horizon Trust, and I will not repeat it here. But they include the government of the Gambia, incorporated Horizon Trust in the UK, his extensive network, University of Aberdeen, Baylor College in the USA, WHO Gambia, MRC Gambia, Brussels Airlines, Gambia Experience, Fajara Chambers, the African Development Bank, to name but a few. And his notes, which are in my speech, show all the names and the help he received from these great people. But I will skip that at this moment and just go on because it has already been spoken about. So anyway, James then met others of like minds, but private investors, Gambians, Nigerians, and others. These, especially the Nigerians, had the long-held view that a referral hospital was required, even necessary in West Africa, to allow those seriously sick to find care in their region rather than abroad, where family can travel with them and they can feel at home. That way, they held, these Nigerians, philosophically, the view that as the seriously sick healed, their dignity and psychic energy is preserved. They can heal in private and in these beautiful surroundings. And those who are not Gambians can return home feeling whole and rejuvenated. They agreed to invest at that stage. There was still another flank open in the financing. James entered in his note that the Islamic Bank came into his help in 2014. And finally, as we get ready for today, another flank has finally been covered in the financing by the GT Bank Group. In my view, the most efficient bank in Nigeria and in the West Coast. This then, Your Excellency, is, Mr. President, is our journey to this day. Today, you do us the greatest honor of breaking the ground in your beloved country for this new hospital, which is based on the above principles and philosophy. It will be built and will remain a great monument and legacy to your leadership, to the Gambia and its people. We remain eternally grateful to you. The Gambians, the Gambian government, all our friends in the UK, earlier mentioned, African Development Bank, Islamic Development Bank, GT Bank, and our private investors for bringing this dream to realization. We could not have found a better country in West Africa to realize this dream, Mr. President. The Gambia is the only country, and I repeat, in my view, which has the potential of becoming what I envision as an amalgam of Singapore and Switzerland in West Africa. And one country that will give us a second Botswana, but in this part of Africa. May this development initiative be one notch in the fulfillment of this notion. Ladies and gentlemen, our most heartfelt thanks for your presence and witness today of this groundbreaking. Your Excellency, President Adama Barrow, President of the Federal Republic, of the Republic of Gambia, you know I'm in Nigeria. In the name of Horizons, we thank you most deeply and warmly for your kindness and for devoting time to help us break ground today. Thank you.
Thank you very much, Dr. Ojo. I thank the Minister for Tourism and Culture to link up with you, because the praises I had today selling Mamaland is beyond description. From my experience in the broadcasting field, normally the duration of a news headline is 3 minutes. But for today on JRTS, I don't know how long is the news. Thank you very much. I'll now call on Dr. Ian van Bazek, partner AMPC International Health Consultants. Mr. Bazek is a partner with AMPC International and has been involved in projects countries such as Ecuador, Bolivia, Chile, Peru, Venezuela, Nicaragua, Tanzania, Nepal, and Sri Lanka. Mr. Bazek and AMPC has been representing the Horizons Board in providing technical support on all required, oversight on design and contracting activities. Sir, a warm welcome to you. Dr. Bazek, please.
Thank you. Your Excellency, Mr. Adama Barrow, President of the Republic of the Gambia, and all other protocols observed. Thank you for the opportunity to be part of the development and implementation of Horizons Clinic. For many years, AMPC has been working closely together with Horizons for the realization of this magnificent project. From discussions with financiers, implementation partners, to the actual design of the future clinic to be built on this particular spot. Finally today we are at the brink of actually starting the construction of Horizons Clinic. We are in no doubt the positive impact the clinic will have on health of the Gambian inhabitants, and in addition to that, a transfer of skills and knowledge about hospital construction and hospital management to Gambian professionals will definitely assist the Gambian health system as a whole. We are proud to be part of this project, and we will continue to give our best to assure it's actually implemented. Surely, after the first foundation stone laying today, the much anticipated construction of the clinic will commence soonest. Thank you all, and hope to see the clinic here as soon as possible. Thank you.
Thank you very much, Mr. Bazek. I now call on our own Honorable Minister for Tourism, Roots and the culture. The Honorable Minister going places global wide with the dream of transforming the new Gambia to a paradise on earth. To summarize, sir, welcome to you, a big one welcome.
Your Excellency, Mr. President of the Republic of the Gambia, President Adama Barrow, the Secretary General Office of the President, Honorable Ministers of the Republic of the Gambia here present, heads of security organization, namely the Inspector General of Police and the Chief of Defense Staff, members of the diplomatic and consular corps here present, members of the tourism fraternity, especially the Gambia Tourism Board, distinguished guests, invited guests, all other protocol duly observed. Today witness another part of our history. Mr. President, I stand to be corrected. I believe this is the second stone laying of a project since we took up office, the one in Alunghare, and today we are witnessing another one here in the TDA. So, Mr. President, thank you for being with us. It is with utmost pride and pleasure that I stand in front of you today to witness the official laying down of a foundation stone for this very vital project in the heart of the tourism development area. This is occasioned mainly by the fact that this will be the first ever medical tourism facility in the history of this country, and what is even more historic is the fact that this is happening in the dawn of a new era, and that is the era of the new Gambia. Mr. Chairman, distinguished ladies and gentlemen, this event is therefore very symbolic in the annals of Gambian tourism, but most notably in our collective desire to create a new, better Gambia. As we are all aware, the Gambian people have decided this decision is premised on the need to make a fresh start in all endeavors of national development, including tourism, which has been a major pillar of the economy since independence. This new dispensation does accord us all a golden opportunity to inject more vigor in all facets of our national endeavors. We are all cognizant of the fact that tourism is a private sector affair, and government has always felt that for tourism to thrive and flourish, an enabling environment has to be created that ensures that various stakeholders are given the opportunity to invest in many facets of tourism with a view to making the destination Gambia a truly modern African destination that has got what it takes in terms of products to compete effectively in global tourism. Ladies and gentlemen, it is in this regard that I'm very proud to be associated with the mega project, which even though it's a private sector initiative, but devotes with all lofty goals and policy objectives to develop tourism on a sustainable basis so as to increase in its impact. This particular project is therefore very timely and could not have appeared at a more appropriate time when we begin to take stock of strides made in this vital sector and try to reposition it with a view to maximizing the gains of tourism as a strategic sector in terms of job creation and its overall contribution to national economy. Moreover, I have been reliably informed that this project will add a lot of value in terms of product richness and opening new frontiers in tourism product development, as the project entails the construction of a modern, high-quality private healthcare facility in the tourism development area of the Gambia. Furthermore, the project is mainly intended for the encouragement of medical tourism to improve on Gambia's healthcare system and position the Gambia as a prime referral destination with state-of-the-art international best practice medical facility. No more overseas treatment in neighboring countries or in Europe and America, which of course with complicated medical cases associated with huge financial burdens. This project provides the much needed job creation for thousands of Gambians, for hundreds of Gambians, thereby contribute to both direct and indirect tax revenue to the Gambian economy. Above all, as a tourism product, it will increase our annual tourism arrivals. This is very relevant project, and commendation goes to the promoter, Professor James Ndau, for this wonderful initiative. And I'm further informed that the project is to the tune of 27 million US dollar and to be financed by the African Development Bank as well as the Islamic Development Bank and other agencies. I therefore seize this golden opportunity to assure the promoters of our utmost support and partnership to ensure the successful completion of this relevant project. Tourism as a global industry is very dynamic and requires constant innovation in terms of products to adequately meet the needs of our converted guests and to be able to compete effectively. And therefore, cognizance of the value of this product, which will add a new product in our product portfolio and thus create immense possibilities in terms of medical tourism, which is increasingly gaining momentum. The promoters thus deserve all the support, and government is willing and able to provide this top-level support. Mr. President, before I end my statement, I must take this opportunity to thank the British ambassador, who on many occasions discussed this project with me, who had a lot of interest in making sure that this project did not fail. And in so doing, Mr. Ambassador, we thank you so much for your support and love you have for our country. And I cannot also end this without thanking Mr. Antuman Gay, who has demonstrated high sense of patriotism and responsibility in making sure that today we are able to gather here and make this project a success. Mr. President, this is one of the projects that I have no doubt you will lay a foundation stone. In the pipeline, we have over 100 million euro projects lying there waiting for action. I have no doubt that your government is a government that is action-oriented, and very soon the Gambian people will start to see who you are, who your government is, and I have no doubt they will not be disappointed. Thank you very much.
Thank you very much.
The Gambia, the new Gambia, the new look. As Dr. Ojo said, I think Honorable Minister for Tourism, roots I emphasize most of the time, and culture. The slogan global wide is the smiling coast of Africa. But what I heard today, the praises of this tiny island from people, I wouldn't hesitate to open hands and welcome them, embrace them, welcome them to Mama Land. Today is history not in the making. Your Excellency, is history actual. It's now time to pave the way and introduce. Time for the statement by the man of the moment. Of course, no other than Professor James Ndau. But before that, I call on Honorable Cordia Cole, the Minister for Basic and Secondary Education, deputizing for the Minister of Health, Madam Safilo. Honorable Madam Minister, to the podium, please. Thank you.
Thank you very much, Mr. Chairman of the occasion, Your Excellency, the President of the Republic of the Gambia and Commander-in-Chief of the Gambia Armed Forces, Mr. Adama Barrow, Honorable Secretary General and Head of the Civil Service, Honorable Speaker of the National Assembly and National Assembly members present here, Honorable Cabinet Ministers, representative of the Lordship, the Chief Justice, members of the Diplomatic and Consular Corps, the UN and other international agencies, permanent secretaries, the service chiefs, heads of the public and private institutions, representatives of municipal councils, regional governors, traditional chiefs, vulnerable religious leaders, members and friends of the Ndau family, the media, both print and electronic, distinguished ladies and gentlemen, all other protocols duly and respectfully observed. It is indeed an honor and privilege for me to make a statement on behalf of my colleague, the Honorable Minister for Health and Social Welfare, Mrs. Safi Lo Sise, who is unavoidably not present with us here today because of other important engagements. We are all gathered here this morning to this very important groundbreaking event for the laying of the foundation stone today, Monday, 19th of June, 2017, by no other person than His Excellency, the President of the Republic of the Gambia, Mr. Adama Barrow. To begin with, ladies and gentlemen, it is important to acknowledge the national agenda set forth by our dear President, His Excellency, Mr. Adama Barrow's vision and directive to achieve our national development goals with specific focus on the health sector for the new Gambia. It is with this in mind that I am proud of Horizon's hospital project, financed by the African Development Bank and equity investors to the tune of $27 million US. This particular project involves the construction of a 60-bed hospital, which will be equipped with the state-of-the-art facilities. Therefore, it is indeed a great pleasure for me to be part of this historic event for many reasons, but just to name a few. The initiative we are about to launch responds to the national priorities as reflected in the National Health Policy 2012 to 2020. The country's new medium-term plan, page 2, 2017 to 2019, and Vision 2020. This event marks yet another important development in increasing access to and improving quality of health services, in particular maternal and child health services. Access to essential health package for the population is considered one of the key pillars for poverty reduction in the Gambia. Improved access to quality of health care for the population contributes to improvement in the quality of life. Furthermore, Mr. Chairman, Your Excellency, distinguished ladies and gentlemen, it's a true reflection and dynamism of the Board of Trustees of the Horizon Trust Gambia, led by a son of the soil, the indefatigable Dr. James Ndao, Professor of Urology, promoter, Horizon Trust UK, and partners for the development of health service delivery system in the Gambia. Mr. Chairman, Your Excellencies, distinguished ladies and gentlemen, the Ministry of Health and Social Welfare established close links with Horizon Trust Gambia since 11th of February 2013, aimed at providing opportunities to the Gambia health sector in terms of quality service, safe delivery of expectant women, cleanliness and enhancement of capacity development, especially in the area of human resource for health. This is in line with the Ministry's mission statement, which is to promote and protect the health of the population through equitable provision of quality health care. Therefore, interventions by Horizon Trust on the MOU signed with the Ministry of Health and Social Welfare was based on important priorities as follows: establishment of an international standard state-of-the-art health care infrastructure, which will contribute to providing the Gambian healthcare systems. Reduction of maternal mortality, and improvement of maternal and child health in the Gambia, and by doing so help the Gambia achieve key Millennium Development Goals. To complement the efforts of the Gambia in the area of health and social development and clinical research deemed relevant for Gambian communities. To establish a cooperative relationship and arrangement for the mutual benefit of both parties, and also to increase access and promotion of health to all, and in particular the tourism industry. Horizon Trust Gambia's charitable activities include, but not limited to, training and capacity development and support of outreach healthcare facilities, eradication of fistulas, reduction of maternal and child health mortality, and improvement of maternal and child health. Mr. Chairman, Your Excellencies, distinguished ladies and gentlemen, the contributions of Horizon Trust Gambia to the health sector within a relatively short period of time continue to be much appreciated. Notably, Horizon Trust Gambia raised almost over $6 million funding to support 2 maternity wards using solar power, provided over 5,000 items of cleaning materials delivered to targeted health facilities. An estimated $5,000 funding was secured for structural maintenance of targeted health facilities. About 25% increase competency in orderlies and midwives' knowledge of infection prevention and control. More than 130 health workers have been trained in infection prevention and control. The overall impact of Horizon Trust's intervention in the area of specialist healthcare services to pregnant women and children under 2 years of age was improved. High-quality maternal and child care and delivery of over 13,200 babies in a cleaner and safer health care environment. It is with this in mind, I am proud of Horizon's soapbox partnership achievement with the University of Aberdeen in the UK, in collaboration with the Ministry of Health and Social Welfare over the last couple of years, which has witnessed the establishment of 6 healthcare facilities, namely Edward Francis Small Teaching Hospitals, Department of Obstetrics and Gynecology, the Bundung Maternal and Child Health Hospital, Fajikunda, Serekunda, Brikama, and Kafuta Health Centers that implemented the soapbox for clean, safe delivery as an integral part of Gambia Maternity Cleanliness Champions Initiative. Mr. Chairman, Your Excellencies, distinguished ladies and gentlemen, the Gambia Demographic and Health Survey in 2013 showed that maternal mortality ratio for the Gambia stands at 433 per 100,000 live births. This is still very high when compared to sub-regional averages. According to the report of the WHO 2015, the majority of maternal deaths in the Gambia are as a result of direct obstetric complications like hemorrhage, which is bleeding, 37% hypertensive disorders during pregnancy, 11% and sepsis infection 11%, which are all preventable. Available literature as well indicates that the main contributing factors for the high maternal mortality in the Gambia include inadequate access to comprehensive and basic emergency obstetric and newborn care services, lack of trained human resources, transportation, and low socio-economic status of the people. Addressing these challenges and improving availability and quality of CEMONC can contribute to at least 60% maternal mortality reduction. Mr. Chairman, Your Excellencies, distinguished ladies and gentlemen, please allow me to thank Horizon Trust Gambia for their partnership with the Ministry of Health and Social Welfare, the government of the Gambia, and indeed with the country as a whole in supporting the Gambian health services. Horizon Trust is an integral part of the country's socio-economic development and already registering success within the healthcare. I wish to personally thank Professor Wendy J. Graham, University of Aberdeen, UK School of Medicine and Dentistry, University of Aberdeen, her collaborative work with the Medical Research Council, and with Professor Umberto Alessandro and staff of the Ministry of Health and Social Welfare, Dr. Melvin O. George, Chairman of the Gambia Medical and Dental Council, and also Chairman of Horizon Trust Gambia, and not in any way forgetting the dedicated efforts of the late Dr. Hatib A. Binjai, may his soul rest in perfect peace, a veteran and consultant gynecologist who was secretary to the Horizon Trust Gambia. He and the leadership team of Horizon Trust Gambia have proved themselves to be true citizens of our motherland in championing a worthy cause in support of the nation's women and children in particular. Horizon Trust is an example to all Gambian-based charitable organizations and the government of the Gambia through the wise leadership of His Excellency, the President, Mr. Adama Barrow, sincerely hopes that more organizations will meet the challenges of the Gambia in as constructive and supportive a manner as Horizon Trust. He had indeed made a clarion call to all Gambians, both at home and in the diaspora, to continue to contribute to national development when he assumed the mantle of leadership of our dear nation. I should also mention, in the absence of the Honorable Minister of Health and Social Welfare, Mrs. Safilo Sise, who is currently attending the Assembly of Health Ministers meeting within the sub-region, organized by the West African Health Organization, WAHO. Though not physically present at this laying of the foundation stone, but she has continued to provide the enabling environment with her capable team to Horizon Trust. We are grateful to know that Horizon Trust Gambia's activities, both technical as well as humanitarian, have the wholehearted support of its parent organization in the UK. Finally, Mr. Chairman, Your Excellencies, ladies and gentlemen, on behalf of all the stakeholders participating in this project, I wish once again to express my sincere thanks to Horizon Trust for its extremely generous gesture and assure them that future generations will thank them for their laudable contribution to the health care of the children and women of the Gambia. Long live the Gambia. Long live the partnership of Horizon Trust and that of the Ministry of Health and Social Welfare. I thank you all for your kind attention. Thank you.
Distinguished guests, ladies and gentlemen, I personally am proud to be a Gambian. Reasons, I guess, best known to us from what we just heard. My eyes are set extreme right under the tent, making me cast the mind back to small Banjul, narrow streets, the capital city of the Gambia. Of course, Dr. James Now, University of Aberdeen, at the MRC, but I'm casting in mind back to where it all started, our alma mater, the St. Augustine's High School. Thank you. Professor James Now, founder of Horizons, born in the Gambia, studied medicine in Aberdeen, first professor of urological surgery in Aberdeen's 500-year history as a medical school. I've read books, but the Guinness Book of Records, I don't remember seeing any name of a Gambian making that kind of a headline. I've seen veteran doctors here, Dr. Tijan Senghor, Dr. Kabir Cham, Dr. Adam Masala, Dr. Melville George, and of course, Dr. Jones, passing the baton to generation next, and seated here, high up there, envisioning a dream come true. I'm touched emotionally, almost with tears, because New Gambia, we got a lot to revisit. We're supposed to rectify and revamp this tiny island. Peaceful, stability, warm and friendly. That is why today history is going down in the books. Appointed 2001 to establish an academic center, of course, of excellence in Scotland, UK. Secured over $32 million in competitive research funding in the past 10 years. Imagine, whilst we're enjoying those that can make life easy and comfortable, in his own small world, 10 years times 365 or 366 days. Let me get the answers after. Busy thinking about a dream come true waterfront. One of Professor Now's dreams, Horizon will achieve excellence in all what it does, and one day will offer the best healthcare in the world. And it's all happening from the smiling coast of Africa, our mama land. Professor James Now, a big warm welcome to the podium, please.
Your Excellency, Mr. Adama Barrow, President of the Republic of the Gambia, Your Excellency, Mrs. Fatoumata Jallow Tambajang, Minister of Women's Affairs and overseeing the Office of the Vice President, Honorable Speaker of the National Assembly, His Lordship, the Chief Justice, Honorable Ministers, members of the Diplomatic and Consular Corps, Honorable members of the National Assembly, Your Lordships, the Mayors of Banjul and the Kanifing Municipal Council, distinguished ladies and gentlemen, our religious leaders, and all other protocols observed. Today is a day we have worked towards for 10 years, and I realize also today is the beginning of a new chapter in Horizon's journey. A journey that has on so many occasions been a very lonely one, certainly a lonely one for me. The Horizons venture is an exciting yet challenging opportunity, a responsibility I accepted to establish a self-sustainable, high-quality healthcare provision in the Gambia, my country of birth, that uses some of the profits from an international standard private hospital to treat the poor, pregnant mothers and infants under 2 years old, a social enterprise underpinned by wealth redistribution through healthcare. All I've ever done in my career to date was to prepare me for this opportunity. But I was told it could not be done. I was told to aim for less. I was told to start small and to build slowly. The decision was therefore very clear in my mind. Yes, we can, and yes, we will bring the best healthcare in the world to the Gambia, because the question is, why not? And we will do it with honesty, we will do it with transparency, we will do it with good financial and legal governance. And whilst I did not know what lay ahead of me on this day, we started this journey in 2007. I knew I was on the right road. I knew that together we could achieve something special. And the road has indeed been a long one. But if we as Africans aim for mediocrity, we will have no trouble in achieving it. Instead, we went on to secure the funding from the African Development Bank, our continent's development bank, the Islamic Development Bank, private sector divisions, the first for the Gambia. We found incredible private investors, some of them are sitting up here. We found amazing philanthropists, some of them are sitting out here. We found good people within the Gambia that stood shoulder to shoulder with us through all the struggles. This is the first greenfield private sector healthcare investment by our development banks in sub-Saharan Africa. Unsurprising then that it took us 10 years to get here. 16 years ago, when I first stepped into what was then called the Royal Victoria Hospital, I was traumatized by my experiences. The suffering I witnessed, I had never encountered before. The events that unfolded in the subsequent years brought me closer to my vocation as a doctor, and indeed cemented my passion for volunteerism, returning to the Gambia to work charitably year on year. However, by 2007, I was confronted by the stark realization that charity was not the solution for our health sector challenges in the Gambia, nor in the rest of sub-Saharan Africa. It was clear that the private sector had to be the catalyst to the social impact the people of Africa desired, because only through entrepreneurial philanthropy can sub-Saharan Africa regain her pride and dignity. Only through entrepreneurial philanthropy can we secure the sustainable, universal quality healthcare for all of our people, rich and poor. We are tired of the lifelong indignity of begging for charity. As a result, the concept of Horizons model was born, and from that moment onwards, I was always confident that we will witness this day. Confident because the model is underpinned by good business principles and all stakeholders are aligned through shareholding, each with a legitimate expectation of a fair return on their investment. The more profit private investors make, the more social impact also will be found through pro rata dividends paid into the Horizons Charitable Trust. I was born to a wonderful father, the late Dr. Peter John Dow, former Director of Medical Services in the Gambia, who often said to me that he made a promise to God that he will look after the poor and their children. As a child, I resented that commitment because I endured my father saying on many occasions to me that he did not have money to give me for school shoes, to buy books, to pay school fees. Yet I witnessed long queues of people outside his office in Banjul, poor women and their children, coming out of his office with money for their own children, for shoes, for books, and for school fees. However, today I realize that my resentment was born out of my own ignorance and self-centeredness. And on closer reflection, I also realized that those childhood experiences were my first introduction to the true meaning of philanthropy. My first introduction to the true meaning of medicine as a vocation. And above all, a realization in our own continent that women are the cornerstone of sustainable development in sub-Saharan Africa. Therefore, the Horizons Charitable Trust was established to provide the best possible care to pregnant mothers and their children who are poor. Over the past 16 years of doing charitable work in the Gambia, I have witnessed real pain and suffering. I have witnessed, however, real bravery and sacrifice in these women, yet too many of them remain trapped in a vicious cycle of poverty, malnutrition, unnecessary deaths during pregnancy or childbirth, and often the loss of a precious baby. Experiences that changed my own life forever. I have grown to recognize that indeed I am blessed. And with that comes much expectations, including a lifetime apprenticeship of serving others. Volunteerism for me has thankfully never been a matter of choice. It has always been a responsibility, and that is the true meaning of my own vocation. In doing our best to serve others for free, I do not know what at least my own destiny will be. However, I can say to you today that I have discovered real happiness ever since I learned how to serve the poor. 1 in 16 mothers face death or risk of death or serious morbidity during pregnancy and childbirth in sub-Saharan Africa. 1 in 3 of them will bleed to death during pregnancy and childbirth. So why are we all silent? If 1 woman bleeds to death during childbirth in Scotland, there will be a national inquiry. So why is the world silent when our mothers are dying needlessly in sub-Saharan Africa? Why is the world silent? This need not happen. We can do something about it. Each and every one of us has a role to play, no matter how small. The Gambia has all the ingredients needed to be the proof of principle, a future beacon of quality healthcare in sub-Saharan Africa, a beacon of hope, fired up by countless selfless acts of ordinary people, all of us sitting here today. Horizons is committed to doing her part alongside the Ministry of Health. I will finish by saying we would not be here today if it were not for the selfless acts and generosity of so many people. The project has reaffirmed my faith in people. There are good people in the Gambia. For every one unhelpful Gambian we have encountered along the way, there were 50 other incredible, selfless, ordinary Gambians ready to stand with us shoulder to shoulder. His Excellency, the President, honorable ministers, our incredible investors, Gambian and non-Gambian, some of them have traveled a long way from Canada and beyond to be with here today. I thank you for your trust. It would be remiss of me not to thank countless others from the Second Republic that supported this project without needing anything from it. To the selfless trustees of Horizons Trust Gambia and Horizons Trust UK, I thank you. To my long-suffering family, I thank you for your understanding. To my late father and to my late mother, I am sorry I could not work faster for you to witness this day. But wherever you may be now, I ask for your understanding for all the times I visited the Gambia and did not spend more time with you because of my pursuit of the Horizon's ambitions. I leave you all now with my commitment to deliver Horizon's goals with honesty and integrity. I commit to always do the best for the people of the Gambia. And finally, I commit my life to improving the well-being of the most vulnerable in our society, the poor, mothers and their children. So I ask each and every one of you here today, or connected to Horizons in any way, wherever you may be, to join us to create a legacy that generations will be proud of. Finally, I thank His Excellency the President, because without his leadership, we would not be standing here today, 6 months after the new republic. I thank you very much for your support.
I'm moved. I'm touched. From the childhood experience, the upbringing, 16 years back, stepping in the Edward Francis Small, the Royal Victoria Hospital, he was traumatized. But we are made to believe that Gambia was a strong pillar to lean on when it comes to the health sector. Today, day and time, we do know the language wasn't real. From experience, my wife, it's a very long story. And on that, we appealing to the authorities on the high table. GRTS, this is not a news item. I was born into production. Production is my life. I'm ready to serve my life, my experience into production to my motherland, which I love deep down the roots of my heart. This program should be compiled unedited. This is a documentary that can take Mamaland to another level, as I said earlier on, into 2017 and beyond. We suffered a lot. Your Excellency, the moment has come. The time has come for us to face the reality on the ground. Dr. James Now, the Horizon Trust, this is a rescue operation in which all Gambians are proud of. I'm a living witness, acknowledging the presence of Dr. Mboj, pride of Gambians in the medical sector, making headlines global-wide, retired. They should have been serving till now, in boardrooms, paving ways, the University of the Gambia. Seek advice from the generation next. The students are there in the Royal Victoria Hospital. They got endless of stories to tell. As you saw Dr. Samate on GRTS, that is the reality on the ground. Your Excellency, new Gambia, new vision, new hope, and the hope is you. It's time for the laying of the foundation stone. Welcome to you, sir. Your Excellency, you are invited for the delivery of the statement before the official inauguration of the laying of the foundation stone. Your Excellency, sir. Sorry for this.
Thank you, Master of Ceremony. You need your glasses. Thank you, Master of Ceremony. Mr. Abdul Aziz. I think he was working with Radio Gambia when I was going to primary school. He have a lot of experience. Thank you. Speaker of the National Assembly, honorable ministers, members of the Diplomat and Consular Corps, Chairman Horizon Trust, distinguished international guests, development partners, members of the media fraternity, distinguished ladies and gentlemen, good afternoon to all of you. It gives me a great pleasure to preside over this historic laying of foundation stone of a world-class medical facilities, perhaps one of its kind in the sub-region, which is jointly funded by African Development Bank and Islamic Development Bank Private Sector Division. This laudable initiative, supported by Horizon, is in line with our public-private partnership policy, which, when completed, will greatly improve the health service delivery of the country. It will also be of great benefit to the people of the Gambia, both in terms of services that it provides, as well as employment opportunities it will potentially create. This venture will no doubt radically improve the quality of services, facilities and structures for patients as well as staff, both in the immediate future and years to come. This will be transformational. Given the current state of our health system is grossly underfunded and greatly challenged not only by usual communicable diseases, but also lack of investment with its negative health implication for sustainable socio-economic development. The Gambia, under my administration, have clear plans and strategies to address these challenges, formulating and creating the right policies and environment respectively to provide to private sector engagement is critical. Essentially, this is important, and emerging partnership with Horizon is one part of the strategy aimed at transforming and modernizing our public health delivery system to combat these threats to the well-being of our people. For this, I extend my deepest gratitude to Professor James Ndau and his partners, and all those involved in this important initiative that will expand access to quality, timely and affordable healthcare, not only to Greater Banjul area, but the entire country. Fellow Gambians, the Gambia has high hopes for Horizon. Gambia needs and deserves a world-class medical facility. In addition, the need for accessible, equitable, and high-quality maternal and infant health care in the Gambia cannot be overemphasized. Once this new health facility of international standard is completed, we will no longer have the cost to travel overseas for medical care. Each year, the Gambia and the sub-region lost millions of dollars in revenue through lack of international standard healthcare. The Horizon Hospital model represents a new start, which can be really successful by retaining and utilizing the valuable revenues that would otherwise be spent overseas. Today, however, we are witnessing the beginning of a new phase of Horizon and for the people of the Gambia. We are also here to celebrate a new beginning, another new form of democracy called voluntarism, one in which each and every one of us, through our own personal selfless acts, can decide the type of community we want to live in. All Gambians must therefore volunteer their support to ensure this project is successful. Let me now finish by engaging each and every one of us here today, every friend of the Gambia, wherever you may be, to do your part in making this great venture the success our people deserve. I thank you all.
Distinguished guests, ladies and gentlemen, we've been sparked. Confidence has been injected in us. The language is no turning back. And the only way we can achieve Gambia, higher heights, going places, making headlines global wide, is to believe that the more we share, the more we grow. As His Excellency said, we are moving. Oh yes, we can, and together as a team, we can. Your Excellency, now has come the moment to officially lay the foundation stone of the state-of-the-art medical facility in the making. Mr. Mboj, Mr. James Dow, Pastor James Dow, Dr. Melville George, in your safe hands, majestically, towards
Sits down. The trustees, can you come? Yeah.
Thank you very much.